But it's wonderful to have John. You join us. My name's Paul Klenner. I'm your Look Good Feel Better host for this evening's men's class. And on behalf of Look Good Feel Better, welcome along, everybody. So, given that we had a bit of a delay, I'm going to go straight into introducing John. Now, you've probably all read his bio that came out on the link, but it's wonderful to have you back again, John, because I think it was maybe 18 months ago that you were online and we chatted. We chatted back then, and you're looking really well, I must say. So that's good news. He's the chief medical officer at AIA, which is an insurance company, and he was a former doctor for the All Blacks and also for the Warriors. So pretty exciting times, and I'm sure there's lots of stories that you have in those arenas as well. But John tonight though is going to talk about his heart journey and his cardiac arrest, and he's going to share the importance of resilience and perspective and mental health through his recovery and recuperation. And look, you guys know what that's like as well for many of us. You know, we've had to go through our own challenges, and to be resilient and to have a certain perspective to keep on making each day worthwhile is really, really important. And hopefully there'll be one or two takeaways that each of you will pick up from John's talk that you'll be able to use for yourselves each day. So with that, I'm going to quieten down and hand over to you, John, please, and welcome.
Thank you very much. And what I think I'll do before I talk about my journey is to quote John Mitchell, an ex-All Black coach. I'll just my own background in medicine. Obviously, I was a qualified doctor, graduated at Auckland Medical School, did the conventional things, worked in the hospital for 5 or 6 years. Then went to London and trained in sports medicine and came back. And I was very fortunate. North Harbour Rugby was in its infancy of those days, and I got involved with them, and then very quickly the All Blacks. And so I had 15 years the All Black doctor, and I can tell you lots of medical dramas there and players with significant illnesses. And I still see, All Blacks in my practice now on an almost daily basis. And then I got involved with the Warriors and had 15 years there. So I seem to change jobs about every 15 years. So I've got a few years to go then perhaps in the next one. But of interest to the people here and my job, in the last 15 or so years, I've also been chief medical officer of a large insurance company. So on a daily basis, I'm looking at, risk behaviour and obviously paying out for unfortunate people who develop, cancer, heart attacks, and obviously death and those sorts of things as well. So I have my medical background is not just, broken down rugby players or rugby league players. I still do a bit of that there. So my interests are broad spectrum, but I was a pretty healthy guy myself until about 7 or 8 years ago. And in retrospect, I most probably realised before I had my cardiac arrest that there was things not quite right. And of course, you guys are mostly the same. You have signs and symptoms and you put it down to old age or just being a bit unfit or whatever. And the things I noticed early on was I was doing quite a bit of running, just to keep fit. Certainly wasn't an athlete by any means, and going to the gym. And there's a couple of hills that I was struggling on, and I was thinking, oh, Christ, I'm getting unfit. I'll have to train a bit harder, and really didn't put much down to it. And then I went to the gym one day, and my wife, I was going to catch up with my wife afterwards and go and see her mother, who was unwell at the time. And it was a Tuesday night. I felt quite well. I did a CrossFit workout. If any of those know what CrossFit's all about, it's a broad spectrum exercise program, which I think is designed to kill people. It nearly did that to me. And so I went on the Tuesday night, and the next thing I woke up 3 days later in Auckland intensive care. And what had happened is that I did a workout, and apparently I lay down. Obviously, I can't remember this. And the guy running the session said, "Oh, it's very unusual for John to lie down after a workout." And then someone else looked at him and thought, "Well, actually, I don't think he's breathing," And fortunately for me, there was an off-duty policeman in the exercise class that we've done. He was in the Armed Defenders Squad, so he was pretty up to date with cardiac massage, and they started cardiac massage. Then all hell broke loose apparently, and the fire brigade arrived and the ambulance arrived and things like that. And I was shocked, after you mostly see it on TV, people having the paddles put on. I came back into a sort of rhythm and it was barely rousable. I was then taken to the nearest hospital, which was North Shore. It was decided that, for medically, that had I'd had a cardiac arrest, the thing to look after was my brain, which was pretty low quality anyway. And the trouble when you've had a cardiac arrest, that there may be problems with oxygenation to your brain. So I was then paralysed, ventilated, had urgent angiograms and things like that. I was asleep, and I was on a ventilator for 3 days at Auckland Hospital deliberately. One of the rationales behind that, they cool the person down. So I was cooled down. They give me certain drugs, mainly phenobarbital, as well as and other drugs to keep you unconscious, and also to try and help the brain. And I can remember waking up as I was being extubated. That's when the tube which goes down your throat to help you breathe. And I can remember lying in this room and looking at the ceiling because obviously I was on my back, and I thought, where the hell am I? And I said to the nurse, where the hell am I? And she said, you're Auckland Hospital Intensive Care. And I said, what am I doing here? She said, a cardiac arrest at the gym. And I said, well, I'm pretty lucky to survive that, aren't I? And sort of, and I, obviously I was. As a consequence of that, I was in hospital for a couple of weeks. I had a defibrillator put in my chest. My heart condition was caused by a virus. So at some stage I'd had a bad flu or a COVID-like virus even, which had damaged the heart, and had what's called a cardiomyopathy. You may or may not have heard about it. And really, I feel a bit of a fraud talking to you guys because I never felt unwell. The times I was unwell, I was unconscious, and I was ventilated. And when I woke up, the only thing that I was very sore was my chest, because obviously I had a couple of policemen and various other people jumping up and down, and they broke a few ribs, which was a very small price to pay for saving my life. And to this day, about day 5, day 6 after I woke up, they sent a psychologist in to see me and said, look, you must probably be a bit depressed and a bit, and I said, well, no, I'm actually not. And she says, what do you mean? And I said, well, I'm very lucky. I've survived a cardiac arrest outside a hospital, and 10 to 20% of people are lucky enough to survive that. So you guys have mostly been through far worse scenarios from me. And so I was very positive about the event, and I felt how lucky I was to have this event and survive it. Obviously I wouldn't wish it on anyone, and it was a life-changing event. The worst thing after that I felt well enough and I went back to work after a couple of weeks, but I couldn't drive for 3 months, and that was very hard because at that stage I was working in 3 different places. I was with the Warriors, I was with AIA, and I was also having private practice. So Mr. Uber became a very good friend of mine, and I'd be getting taxi rides and Uber rides and doing things like that. So it was a life-changing experience. I think it was more stressful for my family. I've got 4 children and my wife, because they didn't know that, when I was unconscious, would I wake up a vegetable? Would I be brain damaged for life? So I haven't had the experience of, a malignancy. But then a couple of years after that, my life changed. I developed acute rheumatoid arthritis. And once again, even though I'm a doctor, I thought, oh, this is just old age, but it wasn't. It was rheumatoid arthritis. So now I'm on treatment for that. And I think, believe me, most probably having rheumatoid arthritis is more of a handicap than having a defibrillator in my chest. And but life throws some terrible things at you. I found, people say to me, why didn't you have more time off work, or why didn't you do this? And I felt, well, there's no advantage in doing that. I could have sat at home and felt sorry for myself, and life's been unfair. I had a virus which damaged it. Before that, I was reasonably fit, and I'm sure you guys go through why me. Why did I develop this malignancy? Why did I get prostate cancer? Why did I get lung cancer? I've got a good friend at the moment who's a doctor, actually professor at the medical school, and he's had two cancers. He had one, he recovered from that. He's a non-smoker, non-drinker, and then he got esophageal carcinoma as well, which, as you most probably know, is quite a serious cancer. And he was doing well from that. And this week, he developed a secondary in his brain. Had a convulsion, and he's going to have surgery. So I think your journeys, to quote John Mitchell again, are actually far worse than me. What I've learnt from my experiences, you can feel sorry for yourself, and life's not fair. I found being positive about it and getting on with it, and certainly getting back to work. Obviously, as a doctor, when it happened, I had to prove to the medical counsellor that I wasn't any more brain damaged than I was beforehand. So I front-footed that, and I went to see a psychologist. I did some extensive neuropsychometric testing. I got a neurologist to say I was okay. I got a cardiologist to say okay. And fortunately for me, a good friend of mine was the dean of the medical school, and he wrote a reference as well to the medical council. And I was able to carry on practicing because I was okay or as bad as ever, depending on what my patients may think of me at some stage. But you guys have all been through uh, life-altering events, and also you've most probably had surgery, terrible chemotherapy, radiotherapy, and with persistent long side effects afterwards. I've been relatively lucky. I mean, my exercise tolerance is reduced. I can't run, but then again, my old rugby knees mostly wouldn't let me anyway. But then having a chronic illness like rheumatoid arthritis. But nowadays, I don't know if you know, rheumatoid arthritis is a totally treatable disease. When I first went to medical school, people end up with nailed hands and deformed joints and things like that. We can treat that much better. So I've been the beneficiary and recipient of good medical treatment and advanced medical treatment, which hopefully you are. Unfortunately, as a doctor and as a physician, there are some conditions we can't treat. I'm having to deal with that in my daily practice. Reading a lot of medical notes. We have the funding issues of pharmac and non-pharmac drugs for cancer, and I'm sure one or two of you here mostly have come across that problem for that during your clinical careers, and so there's all those sorts of things. But I suppose the message I'd take is that there's always someone worse off than you. We always know that, and it's easy to say that. It's a trite thing to say. I've found there's no benefit, and I've never found any benefit for feeling sorry for myself and saying, well, shouldn't have happened. It's not fair. That doesn't help you. Didn't help me. And the other thing that I was aware of is how much it affects your family. And I think you have to be very honest. And I've noticed things if I'm late home from work and I haven't explained to my wife that I had a meeting or something like that, and she's almost got the police out looking for me, thinking I'm going to be in the gutter somewhere with a cardiac arrest. So I'm pretty good now at sort of communicating. So look, I'm running late, or I'm going to the gym, or I'm doing something, or you've got to remember the people that you live with. And I think it's cancer, heart disease, whatever you want, it affects the whole family. And your children get worried. We're all getting older. Our children worry about their parents' health. There's obviously the financial implications of ill health as well, and what's going to happen long term. So there's all those sort of things which I see on a daily basis. I've obviously thought about myself, but I'm happy to take any questions about what my journey has been. I'm back to looking after. So I still look after a few sporting teams, and I still help out with some NRL teams. I'm slowing down. I'm not the fastest runner on a rugby field now, and I have to run and see an injury. So I hope the injuries happen near the sideline and I'm there. But you're as old as you want to be, really. And my message is keep working and keep being as positive as you possibly can. There'll always be someone worse off, and you never know what's around the corner. So live every day, to the full, and just depends. That's my philosophy, and it's worked quite well. I wish some of these things hadn't happened, but what can you do about it? And I'm sure you guys And if you want to share your stories with us, fire away. You want to ask me some questions about medicine, I'm happy to discuss that. I'm also happy to talk about it from a insurance aspects if there's worries about there. There's all sorts of things I deal with on a daily basis. And obviously I've got friends and family who've had illnesses, similar to what you guys may be going through. And obviously clinically I've dealt with, a lot of people with malignant disease and illnesses. So I'm not just a broken down rugby doctor. And I'm happy to ask any questions. So I'll throw it back
Yeah.
to you guys because mostly a bit sick of hearing me rattling on.
I know. That's great, John. I mean, we've got plenty of time for everyone to be able to ask questions. And I might start the charge on that in terms of what have you seen is one of the most valuable things that men can do to help themselves in terms of getting their minds back in order, kind of being able to reconcile what's going on,
I can,
and
yeah, I mean,
getting back to
what,
more of
what
a normal,
see,
if you know what I mean.
yeah, I think I see it going back even further than that. Men are hopeless at looking after their health. I know it's a cliche, but I see it all the time. Men coming
Right.
into my clinic and they're dragged in with their wife or partner, and please tell them about this or whatever. And so we're not good in preventative health. When I was in full-time general practice, I'd see a women 10 times as often I'd see men, and I wasn't running a gynecology practice. And you know, guys are very cavalier about their health, and you guys may be no different. That you most probably were going on blissfully unaware with your life until something happened. And I've had examples of I was a company doctor years ago down at Chelsea Sugarworks, and I used to go down there and run a clinic once or twice a week for the employees. It was paid for by the company. And I can still remember walking past one of the security guys, and I'd say hello to him twice a week. And after about 3 or 4 months, I was on the way out after doing a clinic, and he said, "John, is there anything wrong if you're bleeding a bit from your bowel?" And I said, "What do you mean?" And he said, "Oh, for the last 4 months, I've had rectal bleeding." And I'd walk past this guy twice a week for 4 months. There was no
Right.
financial barrier for him to come to see me at the clinic. And of course, he had, by the time I diagnosed him, he had metastatic and terminal bowel cancer. And it was just one of those things that, why didn't he do something about it? I think there's going back to the question you asked me, I know that was so men's health, we've got to look after ourselves. And even if you've had a malignancy, there are other things that you need to be, the things that are going to kill most men are heart disease and cancer. And obviously, just because you've had one doesn't mean you can't get the other one. So you need to check your blood pressure, make sure you haven't got diabetes, make sure your cholesterol's fine, if you're getting chest pain, blah, blah, blah. So those sort of things. So just because you've got strike one doesn't mean you can't get strike two. So that's one thing to remember there. Um, I think there's a lot of evidence now that even people with cancer, exercise is a very good thing. There's a number of studies showing that people who've had cancer and are having treatment for it, if they do a regular exercise program, and it could be as simple as, walking 20 or 30 minutes a day. It can be, going to the gym if you wanted to, it could be anything you like. It's shown to be one, it helps the cancer, and two, it obviously helps your CNS and your mood, your affect, and it helps make it very, very positive there. I think in terms of diet, there's not a lot of evidence that any particular diet is better at treating cancer than anything else,
Right. Yeah.
and uh, in treatment of high cholesterol. Unfortunately, what we see on TV of low cholesterol, margarine and low cholesterol, that you're lucky if you can change your cholesterol levels by more than 10 to 20% by diet. And really, if you have a bad cholesterol profile, you need to look at other ways of dealing with that. And statins are very good. And as a cardiology friend said to me, they most probably should be in the water for everyone over 50 in New Zealand, but that may be a bit of an overreach. And so you've got to look after other aspects of your health. And I think you've got to, the other thing, and I see it all the time, is that you've got to keep your family informed of what your progress is with your cancer, because
Right.
it causes no end of trouble, and I have people, and obviously as a doctor, sometimes someone will say, I don't want you to tell my son I've got this, and obviously if we get that, we can't explain to anyone else, breach of medical confidentiality. But you owe it to your family to know the state of play, if everything's going well, or I've had a bit of a setback or whatever. Because people are pretty perceptive, generally, and they know when things are going on. So involve your family, keep them, um, interrogate your treating specialists. So if you are being treated for, and you're told, you could have this or that, because things are changing. Like for instance, with prostate cancer now with a Gleason score of 6, so some of the people on this call may know what I'm talking about by a Gleason score. Nowadays, we're saying that that sort of cancer, we should just be actively looking at it, not actually treating it. Just monitoring it with PSA and regular MRI tests and things like that, because the risk of treatment, the side effects of treatment, which may be urinary problems, impotence, and things like that, outweigh the benefits of treatment. So, cancer's changing the whole time. We're getting better at treating things. The treatment modalities are getting better. And I think, when you're given options about treatment, interrogate your oncologist and say, what's the pros and cons. So don't be quiet, because it's your body. You've got to be your own advocate at times. Take someone along with you. Interrogate the people who are treating you, because sometimes as doctors, we can take things for granted. And dare I say it, I hope there's no surgeons listening to me. Surgeons they almost lose interest after they've done surgery, if you know what I mean. They've chopped the cancer out, get on your merry way sort of thing. And your GP or oncologist may be a better source of information
Yeah.
after. I mean, we know there's a significant risk of depression when you're diagnosed with a malignant, so be open about that, and there are treatments now for depression, that may be applicable here. There may be CBT, cognitive behavioral therapy, maybe medication. There's no need to suffer in silence, so to speak. And, we know that if your mental health is good, it affects your physical health. The interaction is, very, 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 very important. And never give up, that be
Yeah.
positive. The one thing I'd say to anyone here, be very careful of the quick cures. I mean, sometimes you may be in a parlous situation and conventional medicine may not have helped you too much. Um, but if there really was a good alternative cure for cancer, we'd all know about it. So
Yeah.
just be careful about dipping into your KiwiSaver, your life insurance, or whatever you've got to pay someone who may want to do hyperbaric oxygen, or things like that, or intravenous vitamin C, or whatever.
Yeah.
Be very, very skeptical about that. I don't mind patients of mine doing things like that, as long as they do it with an open mind, and have the appropriate other treatment as well. So if you
Yeah.
believe that being in an oxygen chamber is going to help you. There's very little evidence to support that. But as long as you're getting the appropriate other chemotherapy, surgery, radiotherapy, whatever, uh, you know, no
Mm.
problems at all.
It's interesting. I, I'm in New Plymouth, and some of the guys online here are from New Plymouth as well. And the things you're describing, we have exercise groups, and the men go and have coffee together afterwards. And
Yeah,
actually, the biggest benefit is that they learn from each other. Um,
yeah,
this is this treatment or that treatment, people at certain stages and all that sort of thing. And it seems to be quite encouraging for everybody to see others further down the path that are actually still alive, so to speak, or haven't deteriorated, and certain things are working, and that
yeah,
that and getting and guys are talking, which
yeah,
is seems to be a
yeah.
big
I mean,
benefit.
women are very good at it. I see my wife and her friends; they're always catching up, and they talk about everything. heaven forbid some of the topics they talk about, but but we as guys don't do that. We may go to the rugby club and watch a game and then have a beer, but we should say let's meet for a coffee, and I've started doing that now. We've got a group of guys that of different backgrounds, and a lot of us played rugby together against each other, and we meet once a month, and we talk absolute rubbish most of the time, but it's a way of connecting. And some of the guys are
Yeah.
retired, some have health problems, some are fine, and I think it's a very good thing to do, and
Yep.
I do it with other people, and but you're right. Don't suffer in silence, and as you say, if you get into an exercise program with a group of guys of similar backgrounds, similar things, it's therapeutic in itself.
Yeah.
I do it with a couple of mates on a Friday lunchtime, and we have a workout. And, it's a pretty geriatric workout, with a guy running it, and then we have a lunch. Not a boozy lunch. Talk
Yep.
for an hour after that, and it's a great. It's one of the best parts of my week. And
Yeah.
most people it hasn't increased my physical fitness much, but it's good together. We talk, about things, and you get ideas, and you want to do things like that. We lose contact with people, especially once people leave work. It can be a
Yeah.
very lonely existence by yourself. And it's hard to talk to your children about those sort of things. But if another guy, who's had prostate cancer and he's got trouble with, erectile function or something like that, and
Yeah.
someone will say, well, this is what I did, and talk to your doctor about it, and don't be embarrassed about it. Or if you've had prostate removed and you're dribbling a bit, there are ways of dealing with that. There may be special underpants you can get now, which there's things
Right.
which
Good,
can
really,
make your,
really good underwear. Yep.
yeah, exactly, make your life so much better. And
Yeah.
because we sometimes the doctors and we treat people, but we forget how it impacts on people's day-to-day lives, and
Yeah.
we're so other people who've been through similar things, are very useful at talking about it. Like people with head and neck cancers, and often they have the radiotherapy, they have a terrible dry mouth, they lose the taste of food, and eating goes, down the drain because they don't really enjoy it,
Yeah.
and so everything. And then people with colostomies, they're often embarrassed about them, and because nowadays most times you can't even notice the things, and
Yeah.
they don't smell, and there's all those sort of things that people are concerned about. And
Yes.
I can remember years ago with the All Blacks, I had one All Black who I can't name because he didn't want to be named, but he had epilepsy, and he didn't want anyone in the team, or and I knew as the All Black doctor, but even in his Super Rugby side, the players and coaches and didn't know, and I gave a letter which went with the manager of the team, and the instructions: if something happens unusual with this guy, please open the letter and have him
Right. Oh,
explain.
wow. Yeah.
And we did. And to this day, he hasn't talked. And he didn't want to be known about the epileptic All Black, where I've worked a lot with and still do with John Kerwin. Who's a great advocate for men's health and depression, and he's done a lot of good by demystifying. It's all right to talk about your feelings and things like that. So
Yeah.
and JK, had his struggles, believe me, but we eventually got onto it.
No, it's good. Yeah.
Yeah.
So, John, I'm just going to give the guys that are listening the opportunity, because some of these guys are maybe on their own, others are in groups and bits and pieces. So, if you want to unmute, please unmute, and if you want to ask John a question, or even just say some things that what you found that are helpful for you. Yep, go Ron.
Yeah, the Prostate Foundation, they have a stand at the field days at Mystery Creek every June, and I've been there since they started, and spent the whole 4 days. I'll be there again in a couple of weeks' time again, and it's just great to be able to share with guys and try to explain to them. I'm the local coordinator of prostate in Cambridge here, just to make sure that they get their PSA tested and get a warrant of fitness every year. and there's some great stories you hear out here.
I think, Rob, you raised a very good point that what you're doing is fantastic. It's getting people to go into their doctor, and most probably the important thing they're doing is getting a blood pressure checked, getting their cholesterol checked, and a general check, and saying, okay, mate, you're about 10 kilograms overweight. You better start exercising. Getting back to the PSA is the best test we've got for prostate cancer. It's fraught, as you most probably know, Rob.
Yep.
It's not a perfect test by any means. I certainly don't recommend anyone under 55 doing a PSA test. The reason I say that is that, prostate cancer is not common under 55, and it can happen, believe me. But you get more false positives than true positives. And those of you who suffer from prostate cancer know the biopsies and things aren't a lot of fun, So
Yeah.
the PSA is elevated and you haven't got cancer, you don't really want to go through a perineal or transrectal biopsy. And obviously, we would like to have a better test for prostate cancer, and but the PSA is still the best one. So I think where those things at the road shows or whatever it is just getting men to talk about their health.
Yeah.
When I talk to groups of people, for the average bloke, middle-aged to a bit older, the cancers that are going to get them are, bowel cancer, lung cancer, and at a later age, prostate cancer. And, and obviously skin cancers are going to be a problem, especially if you're a farmer in the Taranaki or something like that. You're outside all the time and you're weather beaten. But generally in later life, the skin cancers you get aren't the fatal ones, aren't melanoma. It's squamous cell or basal cell, which are a nuisance and you have to have them chopped out. But they most probably won't kill you, but they can be quite disfiguring and things like that. So I agree with you. It's getting blokes in to see doctors that's the secret of what you're doing, not just the PSA test. And what you can say to them, if someone is really reluctant to have a rectal examination, we're quite happy just to do just the PSA test alone. That's a pretty good screening test. The rectal examination adds a wee bit more, but it doesn't do a lot, because most of you haven't done a rectal examination on someone else. You can only feel a small part of the prostate, and you can't feel the whole prostate, so you can miss things because you just can't physically feel them, But so I think, yes, any chance you can to encourage men, and whether it's prostate, skin cancer, or whatever, to get them into a doctor, you're doing a hell of a lot of good.
Yeah, it's good. Anyone else want to ask a question or just describe where they're at, what they're finding works that you could share with others? Don't be afraid. Come on.
Oh, well, I'll go there, Paul.
Yeah. Cheers, Rob.
Pouring with rain here at the moment, so hopefully you can hear me all okay.
Yep,
it's quite noisy. But yeah, I was diagnosed with colon cancer back in 2020. In fact, May the 1st is when they gave me the terrible news. But it knocked me back for 6, I must admit, and family as well. I'm the first in my family to actually go down with sort of a cancer like that. So but I had it all cut out with me because it was COVID. Within 2 weeks, it was all had a bit of plumbing taken away, and the whole thing then was put back again. And then I basically listened to the docs and paid attention to them. Had some chemo as well, and then after the chemo, it's like a new me now, I must admit. But it's given me a few side effects still, really. But one of the things is I can't lose weight. So I've tried and just do all sorts of things, and it's quite hard, I must admit. But I'm still persevering. I'm still sticking to try and diet and stuff like that. But in just watching what I'm doing. But I've also joined this class is not only just to learn from there, but if anybody's going also through the same treatments, really, to say that I'm a survivor. So because I've got through it, and looking positive and always being positive was my main goal. And as you said, letting family know.
Yeah, I think you raised some very good points there. That obviously you'll be followed up, afterwards with a tumour marker, which is a blood test which goes up if there's a recurrence of the cancer. So it's a good thing to have down. And I think you make some good points in New Zealand. You know, colon cancer is a very prevalent cancer in New Zealand. We don't know what this, maybe diet, maybe our ethnic breakdown or whatever. But it's a problem in parts of New Zealand, and certainly the part that I live in. There's a area-wide screening of, you know, doing occult bloods and things like that. So, you know, it's not a trendy cancer, colon cancer, is it? You know, and you know, it doesn't get the attention that, you know, breast cancer gets and prostate cancer gets, and you know, even cervical cancer, which but it's much more common. You know, I mean, cervical cancer doesn't actually kill that many women in New Zealand, you know, which is great. But you hear a lot about it all the time, and prostate cancer kills more, and you know, bowel cancer is a real problem in New Zealand, and we need to get it sorted out early. And you know, it's a curable condition, hence the screening program. So yeah, I forgot to mention that earlier.
Yeah, well, I think with what I had was, yeah, I mean, I've now, yeah, I'm in the system, so I'm being looked after. So that was the main thing with me. So I mean, I'm pretty fortunate, I suppose, that to be where I am, and rather than just yeah, just ignore it, because I mean, I detected it myself, and I thought so something's not right, but and I thought it was a tablet that I was taking, because I was on a Lipex tablet for high cholesterol, and then they stopped bringing it into New Zealand. So in a way, they did it. They did me a favour by changing they're not doing it, because I changed the drug. I can't take the statins because that made all my muscles ache and everything else. But Lipex, there wasn't any issues. I believe it's supposed to be the same drug, but there's obviously something in there that's causing the statins to cause the issues. But when I tried something else, and I wasn't quite right, so I went back to the doc. I stopped taking it and went back to him, and he just put me in for a colonoscopy. So there was no questions asked. So I thought, oh, okay. Because he asked me what one of those was, and I said, I haven't a clue. So if I've ever had one.
I should mention something about statins. There was a lot of controversy in the past that statins cause a lot of muscle pain and all sorts of, you know, terrible side effects. It's been largely disproven, and when they've done placebo studies of people who are taking a statin and a group not taking a statin, the incidence of side effects is exactly the same. Though I do hear the comment that some statins seem to agree with people, you know, more than that. And initially, after my heart episode, my cardiologist put me on a statin, even though my cholesterol was fine. And I started developing joint pain, and I thought it was that. Unfortunately, that was the first presentation of my rheumatoid arthritis. So it was nothing to do with the statin, you know. So you've got to be careful at times, and you'll hear out in the community a lot of misinformation about statins. Statins are a very good drug, and if you need to take them, you know, try and persevere, because the side effect profile is nowhere near what people say it is, you know. So, and hands up, I've got no shares in the statin industry, you know, so I'm not going to sell it. But it's a life-saving drug, and I think, you know, we're seeing in New Zealand the death rate from heart disease is going down, and we'd like to think that we're getting fitter or whatever, and most probably what it is the better treatment of heart disease by treating blood pressure and treating cholesterol and things like that, you know, and other than the surgery or angioplasties and things like that, it's you know, the being the top of the hill staff rather than the ambulance at the bottom of the hill. So so if you're prescribed a statin, take it. Yeah, be my message.
Yep.
Have we got time for if there's one more person wants to add anything, or just talk about what they find is valuable for what they're currently doing? Otherwise we're going to close up and move into the you know, the products that you've got in the mail. So is there anyone else you find useful?
Yes, John, if I can add a little bit. I'm from Palmerston North Manawatu 2, and exercise was a high focus on what I was given. Example was oral kinetics through the DHB gave me 6 months free exercises, and then the Pink and Steel Prostrate Foundation helped fund cancer physiotherapist program that I've even got on an app, and I find that's really, really good.
Yeah.
But I must also say that I find these web seminars really helps with connections as well. And just the final thing I was going to say, I worked in mental health for 4 years, and I'm sold on the Maori health model of Te Whāri Tapi Whā.
Yeah, well, I mean, I think the best thing you can do is to discuss your health problems with other people, and it's the old story. A problem, shared is a problem sort of solved, really, in a way. You always think your particular issue is far worse than it actually is, and you talk to somebody else, and they give you a solution, or they reassure you, or whatever. And I think it's very important, and that's part of that as well. Is that talk about your symptoms if you're worried. Talk to your doctor about your concerns, because they may not be anywhere near what you think they are.
Hey, thanks, David. That was
Yeah.
The Pink and Steel and the CrossFit classes and exercise classes are fantastic. The work that's going on around the country, that's for sure, making a big difference. Look, we're nearing 7:30. I'm sorry to be talking about the time all the time, but John, thank you so much for all of those insights. So much stuff that you've covered, and certainly family is a big one, isn't it? Because I think when we're got our heads around whatever it is we're dealing with, we don't think about them worrying about us, and they do.
Yeah, I think you're right.
Sure.
We get a health problem, we can become very selfish in a sense.
Yeah.
Everything revolves around me, and you forget the ramifications to your partner, to your children, to everyone else. And I think you need to be aware of that and deal with that, and share it with them, and it'll help you, but it'll also help them. So I think you've got a responsibility, but not telling them or trying to hide it from them or whatever, it never works, and that it makes your health worse as well.
So thank you so much for your time tonight. I really, really appreciate it. I know all of the guys online that have come on, I'm sure there'll be lots of different things that they've picked up that they'll go away and think about and maybe utilise or change what it is they do. So on behalf of Look Good, Feel Better, thank you very much.
Okay, well, I'll go and hide my dial, but it's been great talking to you guys, and best of luck, and I'll get out of here.
Yeah, thank you, John.
Okay.
Thanks, John.
Thanks.